Hello, and welcome to CHD Wise, an education series for patients and families. My name is Rebecca Acosta, and I am the Education Coordinator here at Conquering CHD. Today's topic of discussion is Back to School, Kindergarten to College, and was recorded on July 23, 2020. Every summer, Conquering CHD presents a Back to School series. Considering the current health crisis and the differing plans among school districts, colleges, and universities, we felt it important to present a more specific series this year. Of course, we cannot address every educational scenario or medical situation, but this webinar provides a framework of things to consider and discuss with your individual care team. Joining us today is Kyle Landry, Director of the School Intervention Program for Herma Heart Institute at Children's Wisconsin. Ms. Landry blends her experience in both the education and medical worlds, providing learning recommendations for children, teens, and young adults with congenital heart disease. I'll now turn it over to Kyle for her presentation.
Thank you very much. First, I just want to start by saying thank you for having me. I'm really happy to be here speaking to this group specifically. Conquering CHD and PCHA has always been a really big part of my heart. I've always participated in a lot of different activities. So I'm really proud for the opportunity to speak to some of my peers. So I wanted to start this presentation by saying I've done a lot of back to school presentations in my time, and none of them look like what this year's back to school presentation series looks like. So it's all really, really different. Parents are not asking, will extra time on a test help my kid? Parents are asking, will my kid be healthy and safe if I send them to school? So kind of everything we used to say and all the recommendations I used to have been thrown out the window. And now we're looking at some very, very specific questions that families must answer. So my first disclaimer is I'm not going to give anyone the answer. And I know, me as a mom, I know I want someone to give me the answer, but I can't do that. I have to help families understand what their questions are, what they really need to ask and understand from within their family, from the medical professionals, and from their child's school staff to make some informed decisions. So the topics the presentation are going to cover is the school intervention program overview. So before I even get into what are our choices, what could school look like, I want to talk about what my program is and what we do. Reason being is this program has been really, really helpful for our patients at Children's Wisconsin and within the Herma Heart Institute. And it's something I would really, really encourage our families to advocate for at their own home centers, and the reasons why, and kind of some of our key language or talking points when advocating with your own child's cardiologist or your own primary care provider, etc. We'll then look at the different school options, the benefits and considerations of each. We'll look at some guided questions. As I said, there's questions for the medical side, but there's also questions for the school side. And then just a really what are my next steps, and how do I update my child's educational or health plan to for what COVID might present in the in-person learning environment or the virtual learning environment if the family must choose virtual learning or chooses to choose virtual learning. So first is an overview of the school intervention program that I run at Children's Wisconsin. So the purpose of hospital-based school intervention is that children with cardiac conditions are at risk for neurodevelopmental delays that might impact cognition, social emotional functioning, behavior regulation, and school performance. Again, this does not affect every child with a congenital heart defect, but overall it is a risk factor. We know that doctors recommend school support services for patients with cardiac conditions over 3 times more often than the schools actually provide these services. So that indicates this cohort is largely underserved by medical teams and school teams. And we found that school staff often inadvertently discriminate against children with cardiac conditions by assuming that these performance gaps relate to poor effort or laziness. And that's simply due to lack of awareness about how the medical condition, the symptoms, the sequelae of heart disease directly connect with those school performance delays. When I started this program, something that was really important to me was figuring out what does school staff know, and not like what do we think they know, but really asking them and finding out what they know. And our results from a study were pretty sobering. We did learn, and I guess this number is good if you look at the left, that 86% of school nurses and 76% of teachers did know, they were aware that the child had a cardiac condition. But also, if you look at that number, that's kind of a large percentage of teachers that did not know the child had a cardiac condition. When you look at the next three areas, that's when those numbers get a little scary. We see that only 34% of school nurses and 22% of teachers knew that the cardiac condition could increase susceptibility to illness. Only 32% of school nurses and 27% of teachers knew that the cardiac condition could potentially impact learning. And 25% of school nurses and only 19% of teachers knew that the cardiac condition could increase risk for developmental delay. So that means those teachers and nurses were not really looking for opportunities for early intervention. So while we know few hospitals address the care gaps with different school liaison type positions, there's no consensus on the effectiveness of surveys, effectiveness of services, protocols, or any published standards. One of the things that I wanted to do right away after kind of seeing these numbers was helping develop a plan for how we educate our families. Our families mostly know, but how we educate the school staff, and then how we help our families learn to educate the school staff on what pediatric heart disease and what it is and how it could impact the child's learning. So this little graph is something we developed kind of early on, and this is what we use with school staff. We talk very clearly about typical normal heart development and function. And as you can see, you see the oxygen depleted blood comes into the heart, it gets pushed to the lungs, it gets oxygenated, back into the left ventricle, out the aorta, and that oxygen rich blood is what gets sent through the brain and body. And then if you look on the right, you see an example of a hypoplastic left heart image. For any particular child, we would then sub the image of what their cardiac anomaly is. So this is just an example. But school staff can see really easy with this picture that there's a mixing of blood. There's clearly an underdeveloped ventricle. That means that this purple blood, this oxygen poor oxygen mixed blood is getting dispersed to the brain and body. And so that child's body and brain is really developing in an environment of oxygen deprivation. So what does that mean for the child, or what can that mean for the child? And then we show them this image on the impact on brain connectivity. And the key points here is if you look at the control brain and the CHD brain, you see that there's fewer connection hubs, fewer connectivity hubs, and fewer connections between those hubs. And the way I really kind of bring it to life is by explaining to school staff that they can think of this like cell phone towers. So if you have fewer towers and fewer connections between towers, you're going to get some fuzzy signals. You might get some missed calls, some dropped calls. And if you watch the team, and you can see right away, like kind of the light bulb goes on. They're all nodding their heads and looking at each other. And that's a really easy way to kind of bring a real life example to the child's educational team. So if you're looking at what the school intervention program is and what we offer, well, of course, you're going to see that other hospitals have different complementary programs. You look at social work, you look at child life, psychology, case management. There's a lot of different programs that have school touch points. How the SIP is different and why we say we're essential. The SIP supports patients' school experience challenges in academics, social emotional functioning, attention and behavior, executive functioning, language development, fine and gross motor skills, attendance, and health at school. This is all we do. Our team spends every minute of our day focused on school success for our patients. So whereas the other programs like social work or child life have a wide variety of different family needs they support, school intervention is very focused on school-specific challenges. So definitely not consult-based. We take a comprehensive approach. The other important thing to note is that our staff is completely made up of experienced educators. We've all been trained specifically in cardiac conditions and how they might be impacted by different surgeries, treatments, and complications. So the key functions of our school intervention team, and what I would encourage families to advocate at their own centers for having a dedicated school liaison that evaluates the child's strengths and limitations through different assessments with the child, the parent, the teacher, and the school nurse. It's really important to get all the different perspectives because sometimes the parent or the child's story might not match with the teacher or the school nurse's story. And there's not necessarily a right or wrong, but there's different perspectives that we're coming at. So we want to make sure we're addressing concerns from all the different angles. We want to bridge the information and communication gaps between hospital and school teams. We want to recommend individualized education services and specific accommodations for each individual child's needs. We create customized school health plans. We advocate in person at school meetings. Let me tell you, it makes a huge difference having a school liaison from the hospital sit around that meeting and not even just being able to give medical input, but also coming at it as an educator and having a strong grasp on different educational accommodations that would also help this child. Establishing enduring partnerships with schools to address new health and learning challenges. That one's really important because we know that school needs change over time. So having these enduring partnerships where the school knows they can reach out to the liaison, where the liaison knows they can reach out to the school, obviously the parent has signed consent, and kind of having that working care coordination group is really important over time. And then finally, access. We at the Herma Heart Institute believe that this service should be free to families as a routine part of follow-up care. Because again, if we have the ability to offer resources that helps a child thrive after surgery, it's our responsibility to be delivering those services. And here's an example of our care model. You can see on the left the typical patient-centered care model, which I think patient-centered everything is good. But you can see how in this model, it really kind of leaves a burden on families to be responsible for coordinating all the different patient care among a variety of specialty teams. So when I came into this role, what was really important for me to do was to pull that burden off families and kind of place ourselves as an information hub at the center of a multidisciplinary care team. So as you can see, we really work with all of the different stakeholders to make sure clear and consistent information is being passed at all times. All right, so that's what we do and why we do it. And again, the reason I felt that was really important to share is because this is something I think we should see at every single heart center or heart institute. And it's something it's really easy to kind of mention to your provider and say, listen, the Herma Heart Institute is doing this. This is what they're doing. This is why. Is this something we could, talk about at our center? Is this something we might have access to? Are there social work teams or psychology teams that are doing something similar? And just getting that conversation started, because as we know, the neurodevelopmental component of congenital heart disease is definitely picking up speed. And I think this is just kind of pushing the envelope to what's the next step in the gold standard of care for our kids. So number 2, now we're looking at school choice. It's 2020. I don't know if I want to send my child back to school. What are my options? So the first thing you have to consider, and I know we've all read these, but I think it's irresponsible not to mention them, are the CDC guidelines. So we know that children in general have been less affected by COVID-19 compared to adults. However, we also know that children with certain conditions, and then congenital heart being one of the conditions that was more newly added, does put a child at increased risk for severe illness from COVID-19. The risk of exposure at school. Obviously, the lowest risk would be the students and teachers that engage in virtual-only classes, activities, and events. There's more risk with small in-person classes, activities, and events, groups that stay together with the same teacher. This is what I think a lot of schools are kind of leaning at doing. Students remaining social distance. Some schools have required masking. Some schools have addressed optional masking. And then the highest risk being full-sized in-person classes, activities, and events, a full weekly schedule. Students are not necessarily spaced apart. They share materials, and they mix or rotate between classes and activities. And then the other thing that I thought was really important to include is what the American Academy of Pediatrics says. And in my some bullet points of what I want these key takeaways to be, the AAP strongly advocates that all policies consider a goal of having students physically present in the school. So that's in-person schooling. The importance of in-person learning is well documented, and there's already evidence of the negative impacts on children because of the school closures in spring 2020. And speaking for myself and my own family, we definitely felt the challenges with that completely, blindsided move to virtual learning, something my family had never considered or tried. So I'm very, very aware of the challenges of spring 2020. Also look at the lengthy time away from school and the interruptions of support services, looking at social isolation. the higher increase in child abuse, substance use, depression, and suicidal ideation for our children. And in turn, there's a considerable risk for morbidity and in some cases mortality. And I think that's a very, very real concern. And beyond the educational impact, we saw a substantial impact on food security and decreased physical activity in both children and families, children and adults alike. So returning to school, what are some things that I really need to consider? Returning to school safely amid the COVID-19 pandemic is based on a number of factors. First, and I think most importantly, it includes the severity and complexity of your child's medical condition, the school district's guidelines, what protocols the school has put into place already or plans to put into place, as well as your own comfort level returning to public spaces. So your provider could say your child's good to go. Your school could say we have the best plan of any district in the state. And if you're not comfortable, this will never be the right decision. So just putting that out there. It is essential to review your school district's guidelines to determine whether or not the child should return to school, or if some additional accommodations might need to be added to your child's plan, so then you feel they are adequately protected, even if the school district hasn't taken on that protocol. So for example, if masking is optional for students, if you prefer your child is masked at all times, that's something that you could easily add to your child's education plan to make sure that that was meeting your comfort level with sending the child back to school. And finally, the frequency of COVID cases and the types of school precautions. And these vary significantly between county to county and school district to school district. So that's something that you will need to watch on a daily basis to really get an understanding of what's happening in your particular area. Additional COVID-19 school choice factors. Important factors involved in deciding whether or not to send your child might include, again, like we talked about, basic health and safety, your child's ability to learn and progress successfully in a virtual learning environment. We talked about what spring 2020 looked like. Was your child able to be successful, or is there a way we could make your child more successful with increased accommodations for the virtual learning environment? Access to special education services and accommodations, if that applies to them. Potential loss of instructional time and access to therapy services. Their overall mental health. As I previously said, this is really important. Coping with the isolation from peers, missed social opportunities, and the potential development of separation anxiety. Your family's individual access to internet and technology resources necessary to even engage in virtual learning. Your ability as a parent to monitor, assist, and provide teaching instruction within the home. And then, of course, the financial implications of missing work or needing to hire another caregiver to supervise the child at home during the school day. All of these are really equally important, and they kind of play against each other. So it's really making a list of priorities for your individual family. So looking at the benefits and considerations of the different types of schooling. We're looking at in-person instruction, which could be public or private schools. Virtual instruction, which can be one of two things. It can be the virtual instruction offered by the public or private school, or it could be a fully online program that's separate from your child's typical public or private school. Homeschooling or homebound instruction. So first we're looking at in-person instruction. We're talking about public and private school. Now, I have a larger, much larger list of the benefits and considerations of each of these different options that I am going to send to Rebecca following this webinar, so she can feel free to post. We will also post on our school intervention website so you can see kind of an exhaustive list, but I really wanted to touch on the main factors during this presentation just to keep it very relevant. So first, the benefits of public and private schooling. We look at face-to-face learning, which provides ample opportunities for interactive discussions, questions answered in real time, and teacher-guided practice. It also most likely will look at a 5-day-a-week schedule or some schedule of hybrid high-flex instruction. We're looking at standard 8-hour days, standard bus routes, kind of that return to normal routine with some exceptions depending on the district. It also provides access to in-person IEP and 504 plan services and therapies if they apply to that child, and potentially improved mental health of children, returning to familiar routines, schedules, friend groups, etc. Some of the considerations include that the safety protocol to create this environment may look and feel much different than traditional school. Some examples are the social distancing, the face masks, no classroom rotations. Maybe that means they don't go to gym and art for specials, etc. If and when a classmate or teacher experiences symptoms of COVID-19, the class or perhaps whole school will most likely need to transition to virtual learning for a 10 to 14-day period. This is possible. It's a possibility that this may happen several times throughout the school year. And at that point, it will require the same considerations of virtual learning, including reliable technology, internet access, etc. This could also lead to potential last-minute and unpredictable childcare needs. And then there's the case of we might need long-term substitute teachers. So there might be different teachers coming in and out of the classroom at different times if teachers or staff are exposed. Looking at virtual instruction. So this is public and private instruction, a virtual option given by the child's typical school, or a fully independent online virtual school. The benefits look at participation in live streamed or pre-recorded lessons led by public and private school teachers. The schools may be able to provide varying degrees of IEP or 504 plan services and therapies virtually. Of course, that instructional delivery and the service hours may need to be adapted. Public and private school virtual learning will likely be better structured than it was in spring of 2020, as schools have had time to plan, prepare, and provide various forms of professional development to staff. So that's a very, very good thing. And then the online schools, they specialize in virtual learning. So they will likely have a more robust online program than the public and private schools are establishing just for this kind of crisis home learning time. Considerations. The child or children must remain disciplined to keep up with their classwork schedule with minimal teacher support. This can be really hard, even if you think back to maybe you took an online class in college or something like that. It can really be hard to remember what's due when, what do I have to log on to at what time, do I have to respond to 3 comments, and kind of keeping that all in track and organized can be difficult for an adult. So this is also a challenge for many children. Virtual IEP and 504 services may not be as individualized or effective for a child's in-person learning. Of course, the potential feelings of isolation. And then therapies such as OT, PT, speech, some mental and behavioral health services, they may need to be provided in full or partly a supplemental version by private or clinical therapists to support the child's development if they are not receiving that school-based therapy that they need. Homeschooling. So the benefits of homeschooling are that the schedule, routine, and curriculum is completely flexible to the parent's needs and ability level. A child can be taught exclusively at their own developmental level, moving at their own pace, which may lead to faster progress and fewer frustrations. The considerations, however, are that the parent or another adult is the child's primary teacher. The parent or other adult must identify a teaching philosophy and must select a curriculum that meets state requirements. They must understand homeschool regulation and maintain legal compliance, and these laws vary from state to state. They're pretty easy to look up, but they can be very different. Therapies, again, such as OT, PT, speech, and mental and behavioral health are typically provided only by private or clinical therapists to support the child's development. And it is difficult, though not impossible, for a parent to maintain a full-time job, and this, of course, may increase financial strain on the family. And finally, homebound instruction. This one's a little bit different than the other options, but we included it because we've got many, many questions about could my child qualify for homebound instruction where we stay at home but the teacher comes to us. So we did want to include it in the slides. So the benefits are, traditionally, the teacher or teachers travel to the child's home to provide one-on-one in-person instruction, assist with work completion, and help the child progress towards their educational goals and services, with the caveat that some of these may be virtual during this time period. Considerations, though, are this homebound instruction requires an extensive qualification process as part of an IEP or 504 plan. This requires physician recommendation and signature, and the services may be limited to 1 to 2 hours a few times a week, generally for a finite period of time, so many children will still require independent or parent-assisted work time as well. Part 3. Okay, so I know what you do. I know what my options are. Where do I go from there? Here's where you need to kind of ask your questions. So we've we've created a guided questions type tool that looks at what should I be asking my child's medical provider. That could be the cardiologist specifically, that could be the primary care provider, or it could be both. And what questions should I be asking my child's school team to help me make the most informed decision for my family. These are questions for the child's medical team. Similarly to the options, we also have a more exhaustive list for the medical team questions and the school questions that I will provide all to Rebecca to post. I just wanted to go over kind of my main questions within these slides, but I will absolutely give you access to all of the questions we have. Number one, is my child at a greater risk of contracting COVID-19 because of his or her underlying health condition? Is my child at a greater risk for a severe COVID-19 related complication because of his or her underlying health condition? How can I keep my child safe during COVID-19? Can my child safely return to school this fall? Does my child need to wear a mask at school? Does sending my other children to school and or daycare put my child with an underlying health condition at risk for contracting COVID-19? And will my medical team write a letter stating that I need to stay home from work to care for my child? The HHI has, we've had our providers answer all these questions, so I'll also provide those responses. However, your home centers, your providers might have different answers. So I really want to make sure you're getting the answers that are specific to your child's needs. These are questions to ask the child's school teams. Number one, can accommodations be added to my child's IEP, 504, or health plan to ensure my child receives teacher or staff support following safety protocols at school? So for this question, we looked at things that would protect their health. For example, the general school might not be required to wear a mask. I think I brought this example up earlier, but I would like my child to wear a mask. So what can we do to make sure that that happens in the school setting? Number two, what virtual instruction changes have been made to improve the remote learning from the 2020-2021 for the 2020-2021 school year? Or will virtual instruction be similar to 2022? I think this is a really, really important question to ask, because I think it's really easy to say, that was horrible, I'm not doing that again. When a lot of schools have developed some much more robust and comprehensive plans for how virtual learning will look this school year. If my child begins the school year with virtual instruction and struggles significantly, what resources will the school offer to improve my child's ability to learn and participate with remote learning? And will there be opportunities for my child to switch to in-person instruction if it just isn't working? And I've asked this question to local school districts. The answers vary dramatically. So I think it's a really good question to get an understanding of what your district will offer to your particular child. How will my child receive special education services and/or therapies while participating in virtual learning? Will service time and frequency follow my child's IEP? Again, if your child has an IEP or a 504 plan, this is an essential question to ask. You want to know, how will my child receive their services? Will they receive their service time and frequency as it states in the IEP? And the last one is, what should I do if I'm concerned that my child is falling behind or regressing in specific academic or developmental skills? It's really important to have an open dialogue with your child's school about that. Hey, this isn't working. I'm not ready to switch to in-person school, but we need to make some changes. So setting it right off the bat with the school team of, what do I do if I notice my child is falling behind? And then similarly, but also very different, there's questions for a college-aged child to be asking, or I guess adults at that point to be asking as well. The responses will obviously vary from college to university, but these are the main bucketed things that I would recommend a college student be asking. What is the process for applying and qualifying for accessibility resource services to secure accommodations related to my cardiac condition, disability-related learning needs, and COVID-19? So on many college or university websites, you can find they're called many different things: disability resource centers, accessibility service centers. Figure out what your school calls theirs. Look at the requirements for qualification and look what you need to do to apply. I highly, highly recommend doing that. Even if you don't really need accommodations at this point, getting them put in place for you to use if you notice something is slipping. Which just taking the proactive approach is super helpful than having struggles and then trying to get caught up. Number 2, will all classes have sections offered online? If not, can virtual learning options be offered as a medical accommodation for classes that are only offered in person? I would think in 2020 there would be sections offered both in person, hybrid, and fully online. But if there's a necessary course that you need for requirements and you're not comfortable going to school, it's absolutely appropriate to ask for that to become a medical accommodation. And last one, what is the process to apply for private rooming and bathroom access as a medically related accommodation while living on campus? This is a question I get asked a lot, and obviously a lot more now in this time period. But private rooming and private bathroom access is very hard to qualify for. For children with underlying medical conditions, kind of in the time of a viral pandemic, it's really good to get an understanding of what the requirements are and then talk to your provider. Is this something you would recommend? In many cases, they'd probably say no. You're a typically developing adult, and you'd probably do fine in the shared setting, but you don't know the answers unless you ask. And if the provider does recommend or support that private rooming, you'll kind of need to get the ball rolling sooner rather than later, setting the proper documentation up for those resources. And then our last part, again, this is really brief because I could give another like hour-long workshop on school health and educational planning updates. But I kind of wanted to give everybody some next steps. Okay, I've made my decision. I'm sending my child to school, but I'm still not comfortable. What do I do now? So here are some of the next steps I outlined. If your child has a pre-existing educational plan, that could be an IEP or a 504, you can contact the case manager and ask for new COVID-related services or accommodations be added to address expected health, behavioral, and/or learning challenges based on your chosen environment. So what could be added to support in-person learning, and what could be added to support virtual learning? And again, what could be added proactively if I choose to send my child in person, but if there's a sudden switch to virtual, how do I make sure there are no gaps in services and my child has the support they need right away? If your child does not currently have an educational plan, but you've noticed significant academic or social, emotional, developmental struggles, here's what you would do next. If you are anticipating the need for additional school support services or accommodations this school year, you need to provide your concerns in writing to the school. I always tell people to write it twice. Type it up on the computer and send it via an email. And then in the email address, I will be sending a hard copy for my child's records. That makes it really clear that this is a formal documentation that you're sending to the school. In it, you want to include your child's cardiac condition and any associated neurodevelopmental challenges, or increased susceptibility to illness, stating that your child is high risk for both illness, developmental delays, neurodevelopmental delays, if, of course, applicable to your child, along with your specific request for your child to be evaluated for either an individualized education plan, a 504 plan, or if it's just a health plan, which we're going to get into next. The third thing being a school health plan. All children with cardiac conditions, even very, very minor or ones that have been corrected in infancy and the child has done very well, all children who attend school in person should have updated school health plans. So you'd want to ask your school nurse and your hospital cardiac care team to recommend appropriate health accommodations and that consider your child's unique health changes all the time, every day, but especially in this time of COVID. These health plans should include any COVID-related precautions recommended for your child that are not followed by the school-wide policy, which again goes back to the example I keep using of if masking is optional and you would like your child to be masked at all times, this is totally appropriate to be added as an accommodation into your child's health plan. So that's kind of a wrap up of the school options. I wanted to share with you everything that I would lay out for our school intervention families in the Herma Heart Institute. These are the options. These are the questions I would ask, and then here's what to do next. But as I said, I could go on for another probably like 6 hours, giving tools and resources of what those next steps are and getting those plans in place. So I'm going to provide what we have to Rebecca to add to your website or however is most appropriate. I'm also going to put all of the resources on our school intervention website, but I also want to let you know that it's totally okay to reach out to me directly and say, hey, you talked about, for example, setting up an updated IEP with COVID accommodations. What would you ask for? Questions like that. I have all of those resources ready, and I'm willing and able to kind of customize them to meet your individual needs. So again, totally appropriate to email me directly with a related question or request for use of some of the language we use. This is my concern. How do you guys state it to the school staff? Totally happy to share and support those needs if you choose to reach out to me directly. So that's what I have for now. And again, I thank you for listening to this talk and welcome any questions you might have.
Thank you so much, Kyle. Wow, that was a wonderful presentation, especially considering this global health crisis that seems to be continuing on for quite some time. So on behalf of all the staff and the volunteers and the patients and families that we serve here at Conquering CHD, we really appreciate your work and your partnership and collaboration with us in making sure that all CHD patients get the best education they can possible. Like Kyle said, please feel free to reach out to her directly and visit the Children's Wisconsin School Intervention page website. And you can also contact me for follow-up questions, Rebecca Acosta, the education coordinator at CHD Wise at conqueringchd.org. Thank you everyone for tuning in, and we'll see you next time.
Thank you.